Hello, good morning. Today we will talk about diabetes, where we will give relevant information about the pathology. My colleagues are Javier Guajardo, Catalina Bravo, Ignacia Machuca, and myself, Gabriel Espinosa. Diabetes is a chronic metabolic disease characterized by high levels of glucose in the blood, which over time can cause serious damage to the vital organs, such as the heart, blood vessels, eyes, kidneys, and nerves. There are two main types, type 2 diabetes and type 1 diabetes. Over the past 3 decades, type 2 diabetes has shown an alarming increase in countries of income levels, making it a challenge for health systems worldwide. For those living with diabetes, access to normal treatments such as insulin is essential for their survival. Against this backdrop, the global community has set a goal of halting the rise in diabetes and obesity in 2025. Highlighting is the need for urgent action to combat the disease. Epidemiological data to consider. 112 million ages 18 years older are living with diabetes in America. This figure and triplicate in the region, and 1990 prevalence increased more rapidly in low-income countries than the high-income countries. Diabetes, including diabetes-related kidney disease, causes approximately 8 million years of life loss annually due to premature death. The expanded epidemiology is diabetes goes hand in hand with increased risk factor. The America's most overweight, obesity, and physical inactive regions of the world.
Diabetes is a chronic metabolic disease characterized by elevated blood glucose levels or blood sugar, which over time leads to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The most common form is type 2 diabetes, usually occurring in adults, which happens when the body becomes resistant to insulin or does not produce enough insulin. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin on its own. For people living with diabetes, access to affordable treatment, including insulin, is essential for their survival.
The nurse do a lot of things, but in this case, some nursing interventions are providing education about the balanced diet, monitoring and recording blood glucose levels daily, administering insulin according to the prescribed schedule, helping patients develop a medication adherence routine that is very important for the treatment, teaching proper food care to prevent diabetic complications. If the nurse didn't do this, the patient's health will be at risk.
The outcomes of the intervention, the goal is improve the patient's health. The objective one is reduce the patient's glucose to a normal range and with insulin in 30 minutes. The objective 2 is reduce the patient's body weight to a normal range in 8 months. And the objective 3 is increase patients' knowledge about diabetes in 19% in 2 weeks. In conclusion, diabetes mellitus is a complex and growing health concern that affects millions of people worldwide. It is primarily driven by lifestyle factors such as poor diet, physical inactivity, and obesity. Early intervention through lifestyle modifications, regular monitoring, and appropriate medical treatment can significantly improve the health outcomes. Raising awareness about prevention and management strategy is crucial to combat the recent trend to this disease. By adopting healthier habits and educating communities, we can make a significant strides in reducing the impact of diabetes mellitus on individuals and society as a whole. Thank you.